Because, you know, there's a lot of different techniques doing a lot of different things, but it'd be nice to have people, both the chiropractors and patients, to say, wait a minute. I saw this guy in the video, and these patients are really happy, and they're all getting well, and he takes care of Broncos and all these players and all around the country. Why don't you do this?
Right. But not everybody can do it.
Well, maybe they can if they see it.
Oh,
are we on?
okay.
Yeah, they can if they see it. And I thought your story was especially special.
Yeah.
And so you first saw me several months ago.
Yeah, like April.
April. And you came into me for unrelenting, constant, piercing, life-altering mid-back pain.
Yep.
And you had history of how much treatment and how long it had been there?
16 years. I'd been to orthopedic guys. I'd had injections for pain. Been to chiropractors, but never for this, or never could get results for this. So kind of ran the gamut. They finally said there was nothing they could do.
Numerous injections.
Yes, probably 4 or 5.
Now, injections are where they stick needles in her back and inject her spine to try to kill the pain.
Right.
And temporary relief, but yeah.
Yeah, but, you know, maybe 3 or 4 months, and it would be, you know, it's a week in bed. When I would have my seizures, my pain, it would be a week in bed, period. Flat on my bed, get up to go to the bathroom, that was it.
Excruciating pain, couldn't move.
Right.
Yeah. And it was in the mid-back.
Yeah, thoracic area.
Thoracic area. Good.
Really unusual.
Very unusual. And then you had an MRI. We looked at your MRI and your x-rays.
Right. And they said it was a bone spur. And it couldn't be removed.
Because it was too close to the spinal cord.
Right. Oh, and it was behind my heart. It was on the inside. Heart and lungs were in front of it. Couldn't do it from the back. Couldn't, like, open me up and do it from the front. So.
Thank God they didn't, huh?
Yeah. I wouldn't, no.
Okay, so then you came in to see me, and what I said, and I remember, is like, you know what? I saw your x-rays and your MRIs, but if with the special type of manipulation, if we can move this 1 or 2 millimeters
right.
and get that spur away, you should be fine.
Yeah.
And you said, let's go.
Yeah.
And what happened?
It was scary. It was good.
After your first treatment, what happened?
It was amazing. I was healed.
Well, you're not. You're still here.
I know, but it's been 16 years. It was off for 16 years. It's going to take a while to get everything settled back into place.
And it was actually it wasn't difficult, because if you by palpating her spine and look at her alignment, by changing her alignment so there wasn't a twisting in the spine, and by changing the position of that vertebra 1 millimeter, I think we changed it for more like 5. It moved as a guess. Because the whole contour of the mid-back changed. She was in a kyphotic, bent state, probably a pain state, like, And the pain immediately went away, and the area's been recovered ever since. And it acts up every once in a while, maybe 10% of what it was.
Oh, gosh, yeah.
And we just, like, every couple of weeks or so, I say, come in. It could be every month. She's had it for 16 or 17 years. I don't know for sure if it's ever going to completely go away. It's a bone spur. But at least we found a way without drugs, injections, and surgery to keep it under control. And with proper chiropractic care, this is what you can have. You know, I'm not here for your business. I'm here for you to understand that these kind of things can be helped. I'm here to tell you as a patient that see your chiropractor and make sure he does something like this, or at least learns about it. And if you're a chiropractor, you know, if you don't do what I do, I mean, I learned by watching other chiropractors over the years. I'm doing this 40 years. I've learned from Jimmy Parker's and Joe Jancy's and Sid Williams and, you know, Reggie Gold's. I've learned from them. Okay, and I continue to learn. So let's do it on your back, or face down.
Face down.
Left foot is turned in. The left heel's turned in. That means this leg is short, then this shorter than this leg. When a foot turns in, and you see somebody with a turned in foot, Okay, that means that the foot is trying to get to the ground to elongate the side. In other words, since this is a short side, her foot will turn in so she doesn't fall. So if I have a short right leg, my foot will go like this and turn in, or go out and turn in, so it keeps me from falling to that side. So that's called a supination. And it's just absolutely indicative of a short leg on that side. Unless she's got a broken ankle and got a plate in there and she doesn't have that. Okay, so we got about an inch here. Now, and then her pelvis is off. So when this twists, it twists this area where she had her spur, where she has her spur. See, she doesn't always have this, but today she does. This is a complicating factor. This hump on her used to be bigger. Hump this way. It was like, oh, and now the hump's smaller. But we got to change the torque in the spine first. So that took care of 80% of it. Still a little bit going on. Go to the feet. Navicular bone. When I was team chiropractor for the Denver Broncos, 1998, I took a course by a very special chiropractor, Dr. Kevin Herron, H-E-A-R-O-N, out of Boise, or Idaho. And it was working on extremities. It was one of the most important courses I've ever taken in my life. Chiropractors, if you haven't taken it, it's a CCEP course, and Dr. Herron and his assistants teach it. It actually was my starting point on many other extremity adjustments other than the ones I knew, and it gave me more knowledge so I could even take those particular treatments that he taught me and those techniques and develop my own. He and I are very good friends to this day. I owe him a lot in my practice. Dr. Herron is a very special chiropractor. I hated to say that, because he was go to his head now. But now we're pretty even. Still not right. Let me do it. Turn your head to the right. To the left, to the right again. Okay, straight ahead. Now, this is called the Deerfield test. If she turns her head and one of these legs change positions, one gets shorter or longer, they change what they are now, then that means there's a subluxation or a lesion somewhere in the spine other than the low back. And it didn't, but she's still short and I can't leave her this way. So what I'll do is turn her over on her back. According to this test, the neck is okay, at least at this time. See, now, by me talking, you know what's going through my mind when I work on you. You think it's nothing, but see, actually it's... You travel from where to see me?
We're in southwest Denver.
About what?
45-minute drive.
45-minute drive. Okay, so I think her talus is jammed. That's this bone here. So listen, it makes a clunk, but it sets the bone in place because there's something going on with this foot. Remember that foot turned in. Now let's recheck it. Nope, it's not it. Bend your knee. Right hip's okay. Let's do this. Bend this knee. You're stuck there.
A little bit, yeah.
Okay, a little bit. Left hip is not performing internal rotation like it should. So again, we'll relax it. Okay, internally rotate. I got to touch your pubic bone? Okay. One more time. One more time. Good. Put it down, put it up. And let's, come on. And nice rotation. Okay, let's see if that helped. Still a half an inch. We'll get it. Or I'll get it next week.
Yeah.
See your neck. Test it out pretty good. Yeah, a little pressure at the base of your skull here. That's the first cervical vertebra, so we'll do the little, come on, relax. Little tap. Left side, come on. Little tap. Now the treatment that fixed her spur, so I do this last, I'll get everything prepared. It's called an anteriority movement, and it's her in a supine position, or up on her, face up. I roll her, lift up her head. I get below the area of pain. Come on. Come on now. About 4 vertebra release, but because her spine is bent and I push up, okay, the vertebra above where I push tend to pop backwards. Then that took the pressure off of her spur. It was a wonderful feeling, wasn't it? Mm-hmm. And so changing things 3 or 4 or 5 millimeters makes a huge difference in her pain. Spur's always going to stay there, but it doesn't have to keep hitting a muscle, a ligament, or a nerve, or something vital structure that gives her hellacious pain and puts her in bed for a week. And now we're pretty close to even. See now, for all normal purposes, it went from like a good inch to down to about 1/4 of an inch. So she'll be fine now. Okay, and we'll do one more thing. Come on up for me. And she's living. This young lady's living a normal life, shoveling snow.
Yeah, carrying boxes, my laundry that I couldn't carry from the basement upstairs. Yeah. Simple things.
Yep. Her husband said, "Thank you, doctor."
Yeah, he did.
Hands behind your neck. Lock your fingers. All right, good. Relax now. Come on. And there's one more. Perfect.
Thank you.
Thank you.
Yeah.
See you next week.
Okay.